Good to have you with us here at 5:30 on 10 Tampa Bay. I'm Josh Sidorowitz.
And I'm Carolina Lead in for Courtney. First, we are taking a deeper dive into the impact new health regulations on who can donate blood will have nationwide.
So in these new guidelines released yesterday, the FDA says that gay and bisexual men will no longer have to abstain from sex for 3 months before they donate. Instead, every blood donor, regardless of sexuality, will now be asked the same questions to determine their risk for HIV.
As 10 Tampa Bay's Eric Glasser explains, for many, it removes the stigma of what's long been considered a discriminatory policy.
I was religiously donating blood.
When he was in the military, Blue Copas would organize blood drives, rolling up his own sleeve all the time. But when he came out as a gay man, he and his blood were literally labeled.
She took a sticker off and placed it on there, and it basically was saying that my blood was no longer usable.
But now the FDA is moving to individual risk-based questions that will be the same for every donor, regardless of their sexual orientation or gender.
This really is a huge change. It's a historic change.
Blood banks like One Blood participated in the FDA research, leading to the policy changes.
Here for One Blood, we enrolled them in Orlando and in South Florida. And all the data collected from that study was provided to the FDA, and it contributed to their decision making and moving to this new policy.
There's no way of knowing just yet, but by making more people eligible to donate, it's estimated the blood supply could increase somewhere between 2 and 4%.
As an infectious disease doctor, I am very comfortable with this new anticipated increased eligibility.
But for many who've wanted to donate blood, this is also about dispelling negative perceptions.
I think it helps eliminate stigma, making it safer for us to be able to be ourselves, to realize our worth, that we can contribute to society just as others can.
Blood bank operators say they just received the official guidelines language from the FDA. They now need to update their risk assessment forms and train staff. That'll take time, but they expect the new policies will take effect over the next couple of months. In Tampa, Eric Glasser, 10 Tampa Bay.
Now, under these new guidelines, there are still some people who are not eligible to donate blood, including anyone who has ever tested positive for HIV. Also, those who take pills to prevent HIV through sex are still barred until at least 3 months after their last dose. The FDA says that's because medications known as PrEP can delay detection of the virus in screening tests.